When is the best time for someone to seek help?
I think really at any point when they're just feeling overwhelmed with their situation that they're dealing with. So, there's a lot of things that a family doctor can help people with, whether it's, just getting basic investigations like an x-ray, trying things like injections, trying things like physiotherapy, optimizing other health issues. Certainly, I see referrals at all ends of the arthritic process. So anywhere from people just experiencing lots of pain with relatively mild disease based on x-ray to more severe. In general, in Canada, we kind of typically, for a knee replacement at least, like to wait till someone's arthritis is quite advanced on an x-ray before intervening. And, that in itself is a bit of a complicated question, but, I don't have an absolute answer, I guess, to that question, but, basically at any time, I would say if someone's just feeling like they're not managing well.
We do tend to just, suck it up, put up with it, I'm not that bad. And they delay, and people convince themselves that they don't need to see a surgeon or a doctor. So we just continue on, I guess.
Southern Alberta has some hardy folk down here, that's for sure.
Yeah.
I, just having Christmas with my family, I can see my dad slowly getting, worse and worse with his mobility, and but I think he just wants to keep toughing it out for now, and that's totally fine for anyone.
I sympathize with your father because, I find now when I get out of a chair, I make the same noise as my dad made when he was my age. So it's, it's just how life goes. So the future for both of you, long-term in Medicine Hat?
I'm going to let Luke answer that question.
I think so. I mean, it's interesting getting a couple of years into practice and you start to realize, things that you would like to have and things that are going very well and, things you'd like to improve on. And, it's just been, like I said, I don't see any end in sight here. It's been great for my family and, great for myself and, very supportive. So, I've been super happy. The one piece I would like to kind of involve more is seeing more kind of medical students and learners in the operating room. I've been lucky enough to have some old residents and resident surgeons and medical students actually come down from Edmonton to work with me for a while, and it's like that's something I would like to continue to involve in my practice. We're fortunate enough in Lethbridge, they are opening another medical school, so I'm going to be involved in taking on and teaching medical students. I do have family doctor residents who rotate with me routinely, and I'd also like to kind of involve some of the residency programs, say in Calgary, of having resident surgeons come join me, because I think that's a really great way to evaluate your practice and also be exposed to new ideas and ways of doing things, and it's just a lot of fun. I just spent 2 weeks on a medical mission in Ecuador 2 months ago. So we went down there with a group of nurses, physicians, mostly from Calgary, and did about 50 surgeries on the needy people and terrible hip arthritis. So that was a lot of fun, and it just was a reinforcement that that's the educational piece, and working with people at various stages in training is like super important to me. So
So being a mentor,
continue to work with that.
Being a mentor.
Yeah, no, exactly, and I think that's how we all learn, and I think now at this point, I think like I said, I think there's a lot to teach myself through that process. So something I just kind of want to keep building here in Medicine Hat.